Uh, Very good evening. Dearest viewers and followers of Heart Mitra, thank you for staying with us on our ongoing journey towards improving heart health related awareness in India. Do subscribe to our channel Heart Mitra with the handle Your Heart Mitra on Facebook to stay updated with the latest sessions and information on heart health that matters to you. Extending a very warm welcome to all joined in on today's session, which is on cardiac rehabilitation, coming back to life after a heart attack. I, Arindam Datta, am your host for today and will be in conversation with Dr. Priya Chokhalingam. A quick intro for Dr. Priya, uh, who is an MBBS and MRCPCH, and who has also completed her PhD in cardiology from the University of Amsterdam. Her medical training in India is combined with her exposure to renowned healthcare facilities in India, Malaysia, United Kingdom, Switzerland, and the Netherlands. Dr. Priya is the founder and clinical director of Cardiac Wellness Institute and a consultant at the Kaveri Hospitals, Chennai. Passionate about adopting and promoting healthy lifestyle behaviors, Dr. Priya is a thought leader in the prevention and reversal of cardiovascular diseases through lifestyle modification in India. She believes that while diseases such as heart attack, stroke, diabetes, or hypertension are truly global threats, each one of us can prevent and control them if given the right information and guidance. With a strong research background in cardiogenetics and various publications in national and international journals to her credit, Dr. Priya is also keen on understanding the role of genetic factors in the causation of cardiovascular diseases and sudden cardiac death. Dr. Priya is also the author of the book Journey to a Hearty Health, which we will talk about just in a bit. Welcome, Dr. Priya, and thank you so much for sharing your valuable time with Heart Mitra today.
Thank you very much for that kind introduction. Good evening, one and all. At the outset, I would also like to thank Team AstraZeneca for inviting me to join this awareness initiative on their Heart Mitra page. I'm really excited to be talking about heart health in general and about cardiac rehab in particular.
Absolutely. Thank you so much again, ma'am, for joining us. I see your interests and the intentions behind us starting the Heart Mitra page are completely aligned. So I will get right into it for the viewers. And before we dive deep into our topic and hand, Dr. Priya, could you enlighten me and the audience on the purpose and the theme of the book that you have authored, which is called The Journey to a Hearty Health? And why have you personally chosen this as your area of work and specialization?
Thanks for that question. The heart is not only the most powerful pump responsible for uninterrupted blood supply to the entire body, but it is also the organ most affected by our everyday lifestyle and our mindset. Creating awareness about how our choices can impact the heart, both positively and negatively, is the sole purpose of my book, Journey to a Hearty Health. The simple language, practical tips, and real-life examples quoted allow the readers to take meaningful action to keep their hearts healthy. In short, I think we as a population, developing country, are not paying enough attention to preventive aspects. It is a bit too late when people get already affected with heart diseases, cardiovascular problems in the middle of their life, in the prime of their lives. So I think this book is a valuable addition to our awareness initiative and for the people to put into practice the awareness that they're getting from medical sources.
Thank you, Dr. Priya. I think that makes a lot of sense. By the time any of us actually realize that we should take care of our heart, we should have a healthy lifestyle, it's already too late. So we need to have a more proactive approach towards actively choosing a healthy lifestyle that can help and reduce the load on our heart. Moving on to the next segment, Dr. Priya, we know that heart diseases can actually strike anyone at any time. However, there are some common risk factors that make one more vulnerable to diseases like a heart attack or a heart failure. What are some of those risk factors and how can one modify or minimize the risk from them, Dr. Priya?
A very pertinent question. So there are actually 9 risk factors. Each of them is an independent and an important risk factor in the causation of heart attacks. So to begin with, we call them the 3 silent killers. That's our diabetes, hypertension, and cholesterol problems or dyslipidemia. So all of these come without any signs or symptoms. Quite often they are silent and they're capable of causing sudden death. So that's why they call this 3 silent killers: blood sugar, blood pressure, and cholesterol. The next 3 are the behavioral killers. Okay, so the unhealthy diet, the inadequate exercise, and the chronic stress pattern that we all develop as a behavior pattern. And the third row or the third group is our addictions like tobacco, excessive alcohol, and a combination of all of these risk factors leading to obesity. So if we keep these 9 risk factors in mind, I think we will be safe in saying that we can keep these risk factors under control, modify our behavior into healthy patterns, and stay away from addictions. Then we are sure to be protected against cardiovascular diseases. And one way of minimizing or detecting these risk factors early is to be on a regular health check. So from the age of 40, definitely every year or at least every 2 years, each and every one of us should have a routine health check. And if we are prescribed medications, please take them regularly and stick to a healthy lifestyle as much as possible. I think these mantras are more than enough to keep your heart safe and healthy.
Makes a lot of sense. I'm making note of these for myself as well. Uh, you mentioned an age of 40 after which one should regularly, on an annual basis at least, get themselves checked with a full body checkup of sorts. But ma'am, today we see increasingly in India, heart attack patients are young. We see that 30, 32-year-olds who are relatively fit also having heart attacks, having sudden cardiac deaths, and it's really all over the news as well. What might be the reason behind this, and what is your advice to the youth in the country watching this session?
A very true and disturbing trend, Arindam. Men and women in their 20s and 30s are falling prey to heart attacks. So this was not something that we were even taught about in our medical school a couple of decades ago. So, I mean, when they're so young, it's very, very disturbing. The whole family is affected. Of course, if they're fortunate enough to reach the hospital on time, they do undergo cardiac surgery or stenting. They have a long list of pills to take. They may get diagnosed with complications like heart failure and arrhythmias, and of course end up with a very poor quality of life for the rest of their lives. So the only way to beat heart attack, and this is for my young viewers, is to start leading a healthy lifestyle from today. So it's as simple as eating a balanced, healthy diet, making time for exercise or participate in fun outdoor activities regularly, learn to manage your stress, and quit tobacco of all sorts, immediately, this very instant. So I think with this in mind, with this framework in mind, if we can approach this, we are sure to prevent these young sudden deaths. But of course, when we talk about sudden cardiac death in the very young, that's there people less than 40 years old, it's not always coronary artery disease. It's not always heart attack. So heart attack and cardiac arrest are not the same. So I think that's a separate topic and a separate discussion altogether. But the message or the key takeaway is it is most wise to have a healthy lifestyle and regular checks. Even from the age of 20, the American Heart Association says they should at least have every 5 years a baseline evaluation and a checkup to detect, let's say, behavioral risk factors early and to address them. So the cutoff is now not 40 anymore, but it's actually 20 years. So I think that's prudent. And sudden cardiac death at a young age has to be evaluated completely, also with a genetic cause in mind.
That's a few very valid points, Dr. Priya. I think beating a morbid lifestyle, getting into the routine of eating healthy, doing regular exercise, it's, I think, crucial for everyone, not just for people above 40, above 30, but really all of us and all age groups need to keep that in mind. That's some good information, Dr. Priya, you shared about what we might do in trying to prevent diseases like a heart attack. But moving on to the next segment, which is to understand what are some of the classical or non-classical symptoms of heart attack that one should watch out for. And if one suspects such symptoms, what is it that should be their first action? It could be themselves, it could be their near and dear ones, but what are some of these symptoms that we need to watch out for, Dr. Priya, so that we don't miss them out? And I know for a fact that early treatment, early intervention, and aggressive management is crucial. If one were to overlook such symptoms, it's extremely detrimental. So over to you, Dr. Priya, to share some information on this subject.
Yeah, well, the classical symptom is severe chest pain, which we call as angina. Any upper body pain may be due to a heart attack, right? So when we say upper body pain above the umbilicus, so it's the upper abdomen, the chest, the neck, even the jaw, and the upper back area, the arms, the upper arms and the shoulders. So any pain in this area, which is sudden, unexpected, and not easily explained, is potentially a heart attack. So the common mimickers are the gastritis type of pain. So people quite often confuse a gastric acidity pain or a reflux pain with a heart attack, right? So again, of late, we're seeing a lot of people going to their dentist because they have severe jaw pain and they think it is related to their bad teeth or decay or something like that. But again, the jaw pain is referred pain that can be due to a heart attack. So this could be often associated with other things like excessive sweating, palpitation, breathing difficulties, etc. But it can even come completely silent. So we need to be even aware of something called the silent heart attack, especially seen in diabetics. Occasionally in women, we see that none of the above symptoms are there, but they do have unusual fatigue or tiredness, some kind of vague discomfort. All these could also be a sign of heart attack. So women might present very differently from men. So if you or your loved ones experience some of these symptoms, please call for an ambulance immediately. Go to a nearby hospital, which has reasonably good facilities, so that the doctor can see you, evaluate you, do the necessary investigations, and decide if it's a heart attack or not. Very often, even the doctor will not be able to differentiate between a gastritis, a severe gastric pain, and a heart attack. So they need to employ tools like the ECG, some blood tests, and so on and so forth before they come to a conclusion. So don't try to go there yourself. I think quite often, and also in the media, we're seeing a lot of things like which is false information. Okay, if you're all by yourself, cough vigorously, or do some of these techniques is what they're claiming, but none of these are proven. If you're by yourself or if you're driving, stop the vehicle immediately and call for help, call for the ambulance, and get to a facility at the earliest, a healthcare facility at the earliest.
Makes a lot of sense. Well, some of these symptoms we often tend to confuse with gastritis, like you mentioned. It's always better to be safe than sorry, and go out and consult a doctor, get some help to ensure that you don't have a heart attack. Because if you do, it's better to get to the hospital as soon as possible. So the downside risk is very low. So all viewers need to be mindful of that and not take a chance, not wait for the night to pass when you have such a pain.
Especially so because the first 1 hour is called the golden hour. So when they start having symptoms, the first 1 to 2 hours are very crucial. And if they reach the hospital early, then we are sure to be able to protect the heart, save their lives, and give them a good life after that.
All right. And when once a heart attack is detected, and let's say the patient gets to a hospital, just for an information perspective for the audiences, what are the kinds of treatments that are likely to be offered to such a patient? What are the various possibilities?
Yeah, so the three main arms of management are medical management, interventional procedures like angioplasty and stenting, and surgical management. So these are the 3 common modalities. Based on the investigations and the examinations and all the procedures done by the medical team, they will be able to decide which is the best treatment option for each and every individual. It is definitely not one size fits all. So just because somebody's neighbor or their cousin had let's say an angioplasty, it doesn't mean that that applies to this individual also. So everybody has a different set of symptoms and signs, and the investigation will reveal as to what exactly is the severity of the disease, and the expert team of doctors there are in the best position to decide. They will, of course, discuss with the patient, the family, and go ahead with the most appropriate management.
That's good. I think, and for the viewers who are following Heart Mitra, we've also had sessions in the past to detail out more on these three pathways of treatment after a heart attack. So we'll move on really into the meat of what today's our discussion is around. Having a heart attack or even a heart failure for that matter doesn't necessarily mean the end of the journey. With the kinds of modern medical and technological interventions that you, Dr. Priya, mentioned, one can survive such an event. But can such a person eventually come back to living a normal, fully functional life as before the heart attack? What changes? And in this context, please also to clarify and introduce to the audiences what cardiac rehabilitation really means.
Sure, Arindam. So I think quite a lot of times people get depressed, dejected. They think it's the end of the journey when they've been diagnosed out of the blue with a heart problem as severe as a heart attack. But in fact, the truth is, a sudden event like this, a life-threatening event, is quite often the beginning of a new lease of life. So cardiac rehab, I would say, is the magic potion that refreshes, rejuvenates, and restores the person back to a healthy life. In fact, much healthier and more productive than before the cardiac event. So it's not only the medical management or the surgical management that we just talked about, but in addition to that, as a complementary strategy, we have now a new tool on our hands called the cardiac rehab program. So we will be talking about it in more detail as we move on.
Let's do that, Dr. Priya. So just please tell us what are some of the most important components of cardiac rehabilitation, and if I were to undergo cardiac rehabilitation, what would it look like to me? Do the needs of cardiac rehab differ between patients having a heart attack or a heart failure within and outside this group? And in your experience, what are some of the most common unmet needs in Indian patients that cardiac rehab really helps to solve?
Sure. So cardiac rehab, to begin with, is unique because it's a completely proven, scientific, and evidence-based approach. It's a medically supervised program that is tailored to the individual's needs. So the components are dietary guidance, exercise training, stress management, psychosocial counseling, and health education. Each and every patient's clinical and social profile is unique, and so the cardiac rehab program caters to that very well. Due to the work overload that cardiologists and heart surgeons face, they are only able to give medications and a set of do's and don'ts. But the patients and their families are quite often left in the dark with several unanswered questions and concerns. So the cardiac rehab team really helps to fill this gap. So apart from diet, exercise, tobacco cessation, and emotional counseling, sleep issues, sexual concerns, and return to work aspects are also addressed in a cardiac rehab program. So that is why it's called a comprehensive and a holistic approach to patient management. And when you rightly asked me, is there a different approach to heart attack patients and heart failure patients? So heart failure basically means that the heart's pumping capacity has reduced. It can be due to various causes, and the most common cause is after a heart attack. Right? So people with heart failure have typically a low pumping capacity. That is, the ejection fraction of their heart is reduced. They definitely will benefit from a cardiac rehab program. So in the earlier days, we did not subject heart failure patients to exercise because we feared that exercise might worsen their condition. But now, at least in the last decade or so, there's enough evidence to show that even heart failure patients tremendously benefit from a cardiac rehab program and supervised exercise, but it should be under the care and the supervision of an expert team. So that's very important. And the number of sessions in a cardiac rehab program that a heart failure patient needs might be much more than a non-complicated patient like who has undergone, let's say, an angioplasty or stenting and does not have heart failure. So I think, again, as I pointed out, the rehab team, which has a good mix of healthcare professionals in it, is the best source to decide as to what would be the ideal rehab program for each and every patient. And of course, they will discuss the personalized program with the patient, their families, and then with their consent, start off and execute the program.
That makes a lot of sense again, Dr. Priya. Because you said cardiac rehabilitation is literally taking the patient out from the hospital, taking care of various steps, and finally returning them back to work with productivity, possibly even more than before. So that's really encouraging for us all, and then for the audiences, I'm sure. Dr. Priya, the word rehabilitation, and despite me being working in the sector of healthcare, uh, I associate the word rehabilitation more in other contexts, like for people recovering from addictions or from physical sports injuries. But in relation to cardiac health, this is still relatively unknown among the Indian population. Uh, could you comment on why this is so, and where this needs to go in the future?
Sure. So as you rightly said, earlier on after heart attack, patients used to be advised to stay in bed for prolonged periods of time, right? This was the case a few decades ago, but now we know that there's enough evidence to show that undergoing a structured cardiac rehab program significantly reduces various complications and even sudden cardiac death. So we now know that this is a new kid on the block. Yes, it's not as probably old as, let's say, sports rehab or stroke rehab, but cardiac rehab and even pulmonary rehab, so for chronic lung conditions. So cardiopulmonary rehab are, meaning they're closely associated and they complement each other. So this is a very new and developing field, but there's already sufficient evidence to say that it is mandatory to refer patients to these kind of services when available. So we also know that cardiac rehab is equally or even more important than just the medications and the revascularization procedures. Yes, they are life-saving. There's no denying that, but that is not going to help reverse the underlying disease process. What is going to help and reverse your disease process and completely cure you from the root cause scenario is your lifestyle modification, addressing the risk factors in a systematic way.
That sounded like a very important point that you made, Dr. Priya. While interventions, medications, they can help relieve the disease at hand, but cardiac rehab really treats the root cause, and I think that's the real reason why we see such benefits and even reversals of diseases. But just to play the devil's advocate here, and as is the case with any new advancements that come in, people do have apprehensions. But because if a person has already undergone an angioplasty or a surgery, they've already spent so many resources, and they have an unending list of medications that they need to take daily. While we did hear of the benefits that you just mentioned, can't one just read up on exercises and diet over the internet, do it by themselves? Because spending again on cardiac rehab might be a challenge as perceived by many people in this country, especially. So what's your message to me
Okay.
and all other skeptics?
Yeah, sure. I'm glad to answer this question. In short, you're asking me, is cardiac rehab a good to have or a must have, right?
Exactly, ma'am. Yes.
Yeah, I can definitely give you an analogy here. So most of you would have taken the COVID vaccination, I presume.
Uh-huh.
Yes.
Yes.
So just like how the vaccine is a must have and not a, good to have, right? It's a must have to prevent severe COVID disease. So similarly, cardiac rehab is a must have to prevent cardiac complications. So it is the only tool we have to reverse heart disease, as I just mentioned. Any time or money spent on a cardiac rehab program will have definitely huge returns later on, because in terms of reduced hospitalizations in the future, reduced need for medication. So there's tremendous cost cutting in terms of the money that you're spending on your prescription drugs, because your risk factors are under better control. Your complications have come down dramatically. In fact, there is a double bonus. So you not only protect your heart and your blood vessels, but you're also protecting yourself against chronic ailments like stroke, cancer, dementia, depression, osteoporosis, frailty. The list goes on and on.
Wow.
So now we know that cardiac rehab is not only something that takes care of the heart and the blood vessels, so it takes care of almost the entire body. So I think in a way we can call it an investment in our future health. So I think we shouldn't look at it as and most of the cardiac rehab programs are very affordable. So I think we're also in the process of getting healthcare insurance companies to come on board and start reimbursing these kind of preventive strategies and let's say rehabilitation programs, because in the longer term, it's in fact a cost cutting and a cost saving phenomenon.
Makes sense. A lot of reasons why cardiac rehab really is a must to have for all cardiac patients who have managed to survive the first event, certainly. Dr. Priya, are there some patients who need cardiac rehab more than the others, or in other words, is there a particular subset that will benefit more than others by using cardiac rehabilitation? Then probably that's the group that we also need to focus on, and that's the group that needs to hear us very closely and take this talk extremely seriously.
Yeah, so there are several indications for cardiac rehab. The most important ones are heart attack, bypass surgery, angioplasty, heart valve disease, heart failure, cardiomyopathies, even heart transplant, and cardiac devices like pacemaker and ICD. So the list is growing. So it's not just coronary artery disease or heart attack patients. So now we know that a huge variety of cardiac conditions benefit from a cardiac rehab program that is tailored to the patient's needs.
Okay, so I understand if you have any kind of cardiac or have had a cardiac event already, then secondary to it, you must go for cardiac rehab and you are going to find significant benefit out of it.
Very true. There are very few indications or conditions where we have to either delay cardiac rehab or wait until further clearance. So one of that is severe arrhythmias or rhythm problems. Another is they have not undergone a revascularization like bypass or stenting as advised by their medical team. They're still waiting on it, or they're being waitlisted. So in that case, it is better to wait for their procedure to get done and then start on the rehab program. So we generally make sure that the patient is entirely safe and cleared for a rehab program, and then we start them on the program for also better outcomes.
Good. And this question is about where does a patient really find cardiac rehabilitation? I know there are major tertiary care or cardiac centers in the country which have inbuilt cardiac rehabilitation programs. But outside of that, are there specialized centers dedicated to cardiac rehab in India? How does the environment look? And what should be the first step for a patient to look out for such rehab help? Is it the treating cardiologist who's going to refer the patient?
Yeah.
Or how does it work here?
Yeah, very practical question. So referral to cardiac rehab, just to set the stage, is mandatory in developed countries. However, it is yet to become part of routine management. It is yet to become mainstream in India. However, patients and their family members can talk to their cardiologist, their treating cardiologist or their cardiothoracic surgeon about cardiac rehab. A few hospitals, as you said, tertiary care hospitals do have their own cardiac rehab programs, but there is more work to be done on that front. So for instance, Cardiac Wellness Institute that I run is a specialized center dedicated to cardiac rehab for Indians living in India and overseas. So the first step for a patient should be to get in touch with a good cardiac rehab team at the earliest possible time after being diagnosed with a heart problem, or even better, prior to having a heart problem, so that you can keep that deadly killer disease away. So if you have some set of risk factors that we've already discussed, I think, preventive rehabilitation, as we call it, even before you're being diagnosed with a heart attack or a coronary artery disease or a heart failure. If you're somebody who's diagnosed with diabetes, hypertension, cholesterol issues, a combination of other risk factors, it's ideal to contact a cardiac rehab team. Most of the cardiac rehab teams also provide good preventive care. So ultimate aim is to avoid a heart attack, to prevent a cardiovascular disease like a stroke or massive arrest. So I think early action is primarily the most important thing.
It is really interesting that the role of cardiac rehab is not just after you've had a disease, but if you have some risk factors, then cardiac rehab can also play a very important role in prevention or delaying of such cardiac complications in your life. Uh, the next question, ma'am, and I know we're running a little out of time, but hope I can get 10 minutes more. I think this is a very interesting conversation. Uh, this is on the various digital solutions and applications that are available today. I know there are countless apps on digital rehabilitation programs, cardiac counseling, and so on. I also happen to know, Dr. Priya, that you also have a publication on this of looking at the effectiveness of cardiac rehab when it is done physically in a face-to-face format versus when it's done through digital solutions. So what's your take on this, ma'am?
Yeah, so both in-person or face-to-face as well as home-based or online cardiac rehab programs are effective. They're, I would say, equally effective. One important or a key factor here is the risk profile of the patient. So when a patient enrolls for a cardiac rehab program, we evaluate them thoroughly and categorize them as low risk or intermediate risk or even high risk. So as I earlier said, arrhythmias, for instance, that is heart rhythm abnormalities, if they have had some and are under control. So a history of arrhythmia already places a patient at a slightly higher risk for exercise and cardiac rehab. But that does not mean they should not undergo cardiac rehab. So when we risk stratify them, so the high risk patients are best handled in a face-to-face and in-person manner, because we have complete supervision and we are right next to the patient to provide any immediate intervention. Whereas home-based cardiac rehab programs are very suitable for almost all the other patients. I would say 80 to 90% of our cardiovascular disease patients are eligible to undergo home-based cardiac rehab. And I think the COVID pandemic has been a key factor in improvising on the home-based program. So I think it also helps to overcome barriers, like let's say commute time is less. They don't have accessibility issues. And for instance, we cater to our cardiac patients in overseas and other parts of India. And this is through completely online programs. So we do not have any personal in-person, touch point with them at all. And so since the start of the pandemic, this has proven to be very useful. But I think moving forward, there's going to be a hybrid format. So people might be able to come in person, or if they prefer online, or if we think that they're eligible for online home-based programs, we will just provide those kind of programs, and a combination is also possible. So I think home-based and online programs are here to stay. Yes, there are several apps, but I think it's also prudent to see who is providing these apps, who is creating these apps. Is it an experienced cardiac rehab facility with research credits to it? I think that is something the end user has to look into before signing up.
Absolutely. One has to be really vigilant of what they are choosing and buying, especially when it's healthcare. And like you mentioned, there are pros and cons of digital and both face-to-face digital, while and not just for cardiac rehab. I think it's true for any of the services that we offer. The access and the ease of using digital solutions is definitely greater, but the physical, the personal touch that can be found in a face-to-face interactions is always definitely more. That's why we also have started going back to office. So that applies, and the future is definitely hybrid. I think it might always be wise to go upfront to a cardiac rehab center face to face to start off with, and then as things progress, probably we could get into a digital mode, use both as is needed. Uh, To the audiences, I have been battering Dr. Priya with question after question, but feel free to post your questions on the comment section that we will take just in a few minutes' time. And while you do that, a few last set of questions that I have for you, Dr. Priya. And this is also a very practical one that comes out from the patients is what is the duration for which one will typically have to continue cardiac rehab programs after their cardiac event? Is it a lifelong thing that they are signing on for? Is it just a few months? Is it a year? How does that go?
Yeah, so the intensive phase of the cardiac rehab program usually lasts anywhere between 2 to 4 months, or sometimes up to 5 to 6 months. So on average, it's about 3 months, I would say. So 3 months of adhering to any new lifestyle is solid evidence to show that they will adhere to that for lifelong, right? Excuse me. Yeah, sorry for that. So when we say a 12-week lifestyle modification, so they have adhered to a new lifestyle or a new behavior pattern, let's say eating more fruits and vegetables. That's something which we really start at the fundamental as a basic concept. The second thing might be, regular exercise on at least 5 days a week. So we build up on a weekly basis. So we call this the health goal setting. So the patient or the individual sets the goals, and we help them to, identify the different health simple steps that might lead to achieving their bigger health goals. So in fact, we've had our cardiac patients after their surgery or stenting a few months down the line, going back or for the first time running their, let's say, 10-kilometer runs or their half marathons or even their marathons. So this was something that it was not really heard of in the past, but now we know that after a supervised training program, then they should be able to achieve all their health goals. So right now we have a cardiac rehab patient in his early 50s who's an sports enthusiast. He doesn't compete, but he plays badminton, volleyball, at least 4 or 5 different sports that he engages on a regular basis. So he was really depressed that immediately after his surgery, that will he be even able to get back to any of these sporting activities. So right now he's about 8 weeks into his rehab program. He's gained so much confidence. He knows that within no time he will be back on the courts playing all his favorite sports again. So I think that's the kind of support, confidence, and guidance that a comprehensive rehab program can give you. And that's the duration. So in general, I said 3 to 4 months, but there are different phases to it. So the intensive phase has at least 2 to 3 sessions per week. And then the maintenance phase has fewer touch points. So let's say fortnightly, we gradually taper it down to fortnightly, then monthly sessions. Ideally, they should be on a once a month follow-up with the rehab team on a longer term basis. So that's called the maintenance phase of the program. So we are really energized to see the patients, gain confidence. They start achieving their health goals, but not only the patients, but also their spouses, their grown-up children, their caretakers. All of them benefit from the program because we encourage them to attend the education and counseling sessions. So not only the patient becomes healthy, but their family members start, leading a healthy lifestyle. So this is a positive and a wonderful change that, gets us motivated and energized.
Absolutely. And what a transformation it has been over the last decade or so, when heart attacks were catastrophic, life-changing events, to today, with all the technology, the advances in medicine, and now cardiac rehab, people can really go back to their lives, even go back to sports. So that's really relieving, I must say. Uh, Ma'am, at your personal front, what has been some of your most gratifying experiences when it comes to helping patients with cardiac rehab? Do you have any particular stories to share with the audience so
So
we relate to?
Arindam, so let me be very truthful. So each and every patient that we enroll in our cardiac rehab program teaches us a new lesson, and then, makes us feel really great at the end of a rehab program, because as I just said, every session that we provide them kind of changes their health for the better, changes their quality of life for the better. So in fact, I think the last question or the last discussion point is going to be on what are some of the qualitative and quantitative benefits, right? So because we apply internationally validated protocols, and we also have well delineated outcome measures in our patients. So the key benefits that we have seen are symptoms like angina drastically improve. So they don't feel chest pain at all anymore. They're able to do more things, and they're able to do the things that they love to do. They have improved exercise capacity, which means like a simple performance like walking for 6 minutes or climbing up the stairs. They're able to do it so much more easier with the heart actually functioning even better. Their BMI shifts to a more desirable range. So BMI is the body mass index. We see that it really comes down. They're able to sleep better. Again, a very important quality indicator of life, right? The sleep factor. They're able to enjoy life more. They have improved emotional well-being. Okay, so in fact, they have a deep knowledge of their health condition. This is not being catered to or provided by their cardiologist. So they don't know what has happened to them. Yes, they have been treated. They have been sent home, certified as healthy. But they do not have a knowledge of what happened to them, why it happened to them, and how can they take better control of their health. So in fact, the red flag signs, they need to also be aware of what are the few red flag signs in the future that if, for instance, somebody has another chest pain, or if they have breathlessness or symptoms of heart failure, so or if they're exercising and suddenly they faint. So what are some things that they should be aware of, or their family members should know that they should immediately report to the medical team? So I think on the whole, when we approach this as a holistic and a comprehensive approach, the patients and the families are so much more confident. The feedback that they give us is very rewarding. I think that's the most gratifying part of it. So they really provide good feedback. They're happy to be on the program, and they just ask us, why wasn't I aware of this earlier? So could I have prevented it in the first place? So yes, so these are the questions for our youth, the youngsters, who might have parents in their families with heart problems. So they want to take up these lifestyle changes much earlier in life and prevent cardiac complications, sudden death, etc. So I think cardiac rehab participants fare very well compared to cardiac rehab non-participants. There is no doubt on that. Anyway, all of this information is also available on our website, www.cardiacwellnessinstitute.com. So if the viewers want to read it up, go to our blog post section or FAQs, they're more than welcome to do so.
Thank you. Thank you so much for that, Dr. Priya. And on the little research that I was doing, I also found that there's quite a lot of evidence, published evidence, to show that there's improvement in really hard outcomes in terms of death, in terms of having a second event, and they've recorded some very strong numbers like 40% reduction and so on.
Right.
Maybe you could give a few comments on that aspect, in what the emerging evidence is actually talking about.
Yeah, so you have really done your homework. There is a 40% reduction in mortality when somebody follows a cardiac rehab program of this nature. So this is a very significant reduction, right? So that's I think that's why I said developing countries have to start focusing more on these aspects, so their health economics can tremendously improve, and the burden due to CVDs, cardiovascular diseases, can be easily addressed when they start thinking of prevention. So yes, don't worry too much about the numbers. So if we go into the numbers, then there'll be so many things that bog you down, like let's say your cholesterol is haywire, maybe your BP is not under control, maybe it's your blood sugar is not desirable. But I think the changes or the lifestyle approaches that we just spoke about is applicable to all of these conditions. So it's not that each and every condition has a different lifestyle approach. So eating healthy, exercising adequately, having a healthy mindset and an emotional well-being, staying off tobacco and excessive alcohol, and watching your, let's say, body anthropometry, body weight. So these are just a few things that all of us must be doing, whether or not we have any of these conditions. If we have them, yes, these are ideal to bring them under control. If we don't have any of these conditions, great. I think then that's the best path to be on, to stay healthy and productive for the rest of our lives.
Thank you so much, ma'am. We're already 18 minutes over time, I see, but we'll just probably take one last question that has come in just through WhatsApp over to me.
Okay.
And this is related to stress and the psychological well-being of the patient and their family after a heart attack. It's really an event that changes lives. There's probably significant investments that also go in at this point. So how well is therapy and stress counseling integrated into cardiac rehab? The question is on those lines, ma'am.
So I can talk about our cardiac rehab program, which is again comprehensive. So stress management or psychosocial well-being is an integral part of our cardiac rehab program. So there is no doubt about it. So just like how exercise and diet are important, emotional well-being or addressing issues like stress or anxiety or chronic depression. So all of these things have to be, I mean, if that is overlooked or if that is neglected, anything else that we do in the rehab program will not have any use or any effect. So I think the core here is being able to, so as a physician and as my rehab team is used to, we will initially evaluate the patient also on the psychosocial front, but we will escalate it to experienced psychologist or a counselor or maybe even a psychiatrist if need be, when we realize that it involves or requires further expert management. But in general, our rehab program touches upon all of these aspects. And no doubt that the patient and their family members are under extreme stress when such a sudden event happens. So we have seen that very often, almost all of our patients have it, but I think the approach should be that right in the beginning, we also evaluate the patient we use questionnaires, we use history taking, we use different tools, right? So it's a comprehensive evaluation. And finally, how we manage them is also evidence-based.
Perfect. Thank you so much, ma'am, for the last about now 50 minutes of conversation. I would have loved to keep going on with you over this, but yes, the time is a constraint. I'm sure the audiences today have got a very good flavor, if if not more, of what cardiac rehabilitation really means, the comprehensiveness of it, in terms of the lifestyle changes, the dietary changes, the physical exercises, tobacco and alcohol cessation, and even stress counseling that forms an integral part of cardiac rehabilitation, and how it is really linked to hard outcome improvements, improvement in quality of life, improvement in survival rates, and all of which is now evidenced. Which is why I hope this session becomes a stepping stone uh, for India towards having more awareness and interest in cardiac rehabilitation among the population in general, and more so among the healthcare practitioners. Thank you so much, ma'am. This was an extremely enlightening one. If you have any final words before we close for the audiences.
Yeah, I would really like to thank the organizers, thank the audience for their patient listening. So my last advice would be improve your awareness, right? Awareness is the first step. Ask for it. So your healthcare provider would be able to refer you to the right rehab program if you ask for it. So awareness, action, take action, right? Being aware is not enough. Take action, start putting it into effect from today, and finally adhere to it. So if you act on it for 1 month or 1 year and go back to your original bad lifestyle, it's not going to help anymore. So adhere to it. So awareness, action, adherence. So this has to be there throughout life for a heart healthy living. So my best wishes to all of you, and healthy and happy future ahead. Thank you.
Thank you so much. Awareness, action, and adherence. We'll leave it at that. Thank you all for joining, and thank you, Dr. Priya, for taking out valuable time.